A crucial fat-soluble vitamin for health is vitamin D. It promotes bone health, can enhance mental well-being, and aids in sleep. Since sunlight is one of the best sources of vitamin D, many of us don't get enough of it during the winter. In fact, it is believed that 42% of Americans lack the nutrient. As you undoubtedly already know, that the main source of vitamin D is right outside your door, high in the sky. The sun aids in the synthesis of vitamin D in the skin. But while getting enough vitamin D can be beneficial for your health, not getting enough can cause problems. One of vitamin D's many tasks is supporting the development of strong bones and brain health, just to mention a couple. The National Academy of Medicine's Food and Nutrition Board, or FNB, suggests that the majority of persons between the ages of 1 and 70 take 600 international units, or IU, of vitamin D daily. Few foods naturally contain vitamin D, and when they do, the levels are often too low to enable a person to reach the daily recommendations. In response, some food producers have added vitamin D supplementation to their products. A 2020 analysis found that 50% of people worldwide do not consume enough vitamin D. In the United States, 35% of adults suffer from the deficiency. The risk of vitamin D deficiency is higher in the elderly, those with a body mass index or BMI that is equal to or greater than 30, and individuals residing in healthcare institutions such as hospitals. Many vitamin D deficiency sufferers are symptomless. However, lack of vitamin D may contribute to a variety of illnesses. Here are the 10 warning signs that you may be deficient in vitamin D. If you experience these and suspect that you lack this essential vitamin, put extra effort into increasing it in your diet or consult with your doctor about taking a high-quality supplement. So what are you waiting for? Subscribe to the channel and hit the bell icon to get notified when we post new videos. Let's begin. Number 10. Easily getting sick or infections. Vitamin D is one of the body's defenses against germs and viruses that cause disease. Its main objective is to boost the immune system of the body. If you are prone to the flu or the common cold, that may serve as a warning that your vitamin D levels are low and that you need to raise them in order to assist your body's defense mechanisms. Number 9. Constantly feeling tired and fatigued. Despite the fact that there are many causes of fatigue, with stress being the usual suspect, one of the factors that is frequently forgotten is vitamin D. Numerous studies have shown a clear correlation between extremely low vitamin D levels in the body and the level of exhaustion experienced by its subjects. Plus, it had a detrimental effect on their quality of life. Number 8. Sleep disorders. Lack of vitamin D may also be a factor in sleep problems. Researchers discovered that vitamin D made it possible for patients with sleep difficulties to fall asleep more quickly and for longer periods of time than those who did not take the supplement. Number 7. Depression. Lower levels of vitamin D may raise the risk of depression, according to the authors of a review published in 2019. The research shows that vitamin D receptors reside in the brain and that the vitamin has a beneficial anti-inflammatory action. For depression, several studies have also found direct correlation between low levels of vitamin D in the blood with bouts of depression among older adults. As a result, the researchers have drawn the conclusion that taking a vitamin D supplement may be advantageous for someone who has depression and very low vitamin D levels. Number 6. Lower back and joint pain. Calcium, which is necessary for strong bones, is more easily absorbed by the body thanks to vitamin D. As a result, low vitamin D levels in the bloodstream may be the cause of bone and persistent lower back discomfort. Chronic pain may result from this, or it may only occur sometimes. Vitamin D helps boost bone density and stop bone deterioration. An absence of vitamin D may be the cause of joint and bone pain. Furthermore, conditions like rheumatoid arthritis may cause joint pain. An increased risk of developing the condition was related in a 2012 study to vitamin D deficiency. Number 5. Chronic pain. Researchers from the University of Bern in Switzerland discovered that vitamin D deficiency affected 71% of their patients with chronic pain. They experienced pain in several areas of their bodies, in addition to their bones and lower backs. The interaction between vitamin D and our body's pain-sensing nerve cells is what the researchers theorized as the cause of the chronic pain. It is believed the patients might have experienced less pain if there were sufficient vitamin D levels in their bodies. Number 4. Signs of bone loss. Enough vitamin D in the body supports calcium absorption, which maintains bone strength. This is crucial for women after menopause, when bone density can decline and the risk of osteoporosis can rise, according to the National Osteoporosis Foundation. Depending on the patient's age and medical history, the doctor may check a patient's vitamin D levels if they have experienced a fracture. Researchers have found a connection between low vitamin D levels in the blood and low bone mineral density. So ensuring that you always have optimum vitamin D levels in your system is an excellent strategy to protect bone mass and minimize the risk of possible fracture. Number 3. Slow healing of wounds. A study conducted by researchers from the University of Alberta established that vitamin D is crucial in the production of compounds that are critical in the formation of new skin as part of the healing process. A deficiency in vitamin D will seriously impair the body's capacity to heal. Low vitamin D levels may be the cause of wounds healing more slowly than usual, especially for those who have just undergone surgery or suffered a significant injury. According to a separate study, vitamin D deficiency is more prevalent in people who have leg ulcers. The researchers found that those who consumed 50,000 international units or IU of vitamin D each week for 2 months had faster wound healing. Number 2. Hair loss. Stress, aging, and inadequate nutrition are just a few of the many causes of hair loss. Researchers have shown that a lack of vitamin D can be a significant factor in hair loss. Number 1. Cognitive disorders. Vitamin D is crucial to the proper functioning of our brain processes and the health of our nervous systems. Patients with Alzheimer's disease, Parkinson's disease, schizophrenia, anxiety, and depression have been found to be deficient in vitamin D. It was further noted that individuals with low vitamin D levels had a 2.5 times higher risk of developing cognitive impairment than those with adequate levels. It may be more common than we believe for people to have vitamin D-related illnesses. But because many of the symptoms are minor, most individuals tend not to notice them. This might also be brought on by the inclination to search for other causes instead of a possible vitamin deficiency. If you have a vitamin D deficiency or exhibit any of the symptoms, you may want to visit your doctor and have a simple blood test performed. Fortunately, solving this issue is not difficult. Spending more time outside in the sun can help, as well as increasing the amount of vitamin D-rich foods in your diet or trying one of the many supplements available. However, if you are found to be more seriously deficient, your doctor may prescribe higher doses. Thank you for watching. If you enjoyed this video, hit the like button. Please share and subscribe to our channel if you haven't already done so. If you want to be notified of new uploads, hit the bell icon when subscribing.